Friends, I have with me somebody who does God's work. And guess what? Surgeons come after gods because they save lives. A surgeon dealing with breast diseases. And I'm blessed to have him here because I think there is magic in his touch.
Thank you.
He can cut out the negativity and bring purity and wholeness back into people's lives. And I'm not surprised that he's the chosen one to do this. And looking at this tika, which is very spiritual in nature, reminds us that he is in his own command and control, because the science of tilak says that when you put a tilak on the Agyan chakra, you, your body, your soul, your mind is subservient to you. So a powerful human being, master of senses, master of stability, because a surgeon's hands have to be rock steady and eyes as sharp as eagle. Yes. To start with, what is the burden of breast cancer in India? And why do you think there is so much of occurrences today?
So it's a very good question to begin with. Breast cancer is the most common cancer affecting women in our country, with over 200,000 new cases being diagnosed every year and 100,000 deaths per annum. It is the most common cancer. Not only the fact that it is the most common cancer, for every 2 women who are diagnosed with breast cancer, 1 woman succumbs to breast cancer. So essentially, to put it simply, every 4 minutes, someone somewhere in our country is diagnosed with breast cancer, and every 8 minutes, a woman succumbs to breast cancer in our country. And due to lack of awareness and absence of a robust population-based screening program, more than 60% present in the advanced stages, where very little can be done to save lives. And the other aspect of breast cancer in our country is, compared to the West, where breast cancer is more common after the age of 50, in our country, most breast cancers present between 40 to 50, at least a decade earlier.
And every day, Dr. P. Raghu Ram saves at least 2 to 3 people by conducting surgery upon them.
Well, patients come to us on a daily basis, and I've established the country's first freestanding comprehensive breast center. The essential component of the breast center is to reassure the worried well, because when 10 women present with breast health issues, 9 out of 10 breast health issues are benign, that is, not cancers. So, the aim of the breast center is to reassure the worried well, because they think they have cancer, in a purpose built comprehensive center where assessment, that is clinical assessment, imaging, that is mammography and ultrasound guided core needle biopsy, which we refer to as triple assessment, happens in one place, in addition to counseling, so that the vast majority who come to us get reassured and go back within a couple of hours. And those who are diagnosed with breast cancer are treated, and before treated, counseled.
Ladies, you must know that all the knots in your body are not cancerous. They could be out of the trauma defense mechanism inflicted upon yourself. So please don't worry so much. Don't be scared. Be aware. Second question, what are the common myths associated with breast cancers?
So, the commonest myth associated with breast disease is the one that I've just highlighted.
Yeah.
When a woman notices a lump or a breast health issue, she thinks she has cancer, and there is a fear. And because of that fear, she delays going to the doctor. So, when someone notices a lump, they must not fear, because majority are not cancer. So, that's the first myth. The second myth is that people think that older women get breast cancer. Although it's true in the West, in our country, most breast cancers present in a younger age group between 40 to 50 years. The other myth is many people think that breast cancer does not occur in men. Men also can get breast cancer, but it's not uncommon, it's rare. 1%, that is, if 100 people are diagnosed with breast cancer, 1 out of 100 will be in a man. The other common myths, particularly those myths which are associated with deferring to go for a diagnostic test, there are two myths. One is the main reasons why women don't go for a mammogram, even educated people, is they think it carries a radiation hazard and it is painful. Both are myths because the radiation dose from a mammography is less than a chest x ray. So there's nothing to fear because the benefit of mammography, which is an x ray of the breast, far outweighs any risk. The second is yes, there will be momentary discomfort, but it should not be painful if it's done by a trained radiographer. In this day and age of digital mammography, 3D mammography, the compression is less, the accuracy is more, so there's nothing to be worried about. And there are some more myths. For example, people think that wearing a tight bra or applying a deodorant can potentially cause breast cancer. It's not true at all.
So, Dr. Raghu Ram, there is this side of the story and a perspective that there is a disease and there is a solution with surgery and follow up treatments. Now, that medical protocol cannot be challenged at all, it has to be gone through. On the other side, people do things for prevention of relapse and prevention of cancer. Like in my business, what we do, we understand that cancer is a dysregulated intelligence of a human metabolic behavior, endocrine behavior. To bring it back to regulation, self regulation, one needs to step back and breathe in a rhythmic way, eat non cancer feeding foods, fast whenever needed, move non aggressively, observe stillness, which is rest, repair, restore, attend to sounds, silence, meditate, and most importantly, have optimism in the attitude. Then, of course, then there are therapies of massages, there are therapies in naturopathy, there are therapies in homeopathy. How would you opine on that? Which would help one prevent or from relapse or the first time occurrence at all?
Yeah, good points. The first and foremost thing is, can we prevent breast cancer? The strict answer is you cannot prevent any cancer, but we can significantly reduce the incidence of breast cancer by following certain principles like eating a healthy diet, as you rightly said,
Hmm.
maintaining a proper weight, preventing obesity, because fat cells also can
Absolutely.
produce estrogen,
Yeah.
which can act on the breast and cause breast cancer. Daily, regular exercise, aerobic exercise for at least 30 minutes. And very importantly, eating a healthy diet. It's very, very important.
Clean food.
Absolutely. In addition to all this, one has to keep a balance. Stress also is a factor. So, every day, if one can meditate, that is, keep the mind away from the body for a certain period of time, it actually helps to heal the body. So, these are certain ways where you can reduce the chance of getting breast cancer. But what can we do to reduce the chance of a lady who's diagnosed with breast cancer, the chances of her succumbing to the disease? And that is through early detection.
Yeah.
Not all cancers can be detected early,
Hmm.
like, for example, stomach cancer, liver cancer
Hmm.
cannot be detected early. But breast cancer, oral cancer, cervical cancer can be detected early, very early. And therefore, a mammogram, a screening mammogram, is an x ray of the breast. If it can be done once every year from the age of 40, then we can pick up breast cancers very, very early. That is, many years before the lady or the doctor can feel it. When you pick up cancer so early, we can very confidently say that such a person will succumb to old age and not cancer.
Doctor, you've enlightened this world and opened up people's eyes. And I also see, starting from your tilak and talking about meditation, I was visiting a patient in Proton in Chennai. There also, I saw doctors believing in the spirituality part of it, because for those who are spirituality or spiritually inclined, जैसे हमारे संस्कृत में बोलते हैं, जहाँ पर आस्था है वहाँ पर स्वास्थ्य है. स्वास्थ्य की एक परिभाषा है स्वयं में आस्था. How much do you believe that self confidence, optimism, self conviction can improve your chance of survival against those who don't?
I think self confidence and having that much needed inner strength to
Inner strength,
fight the
yeah, yeah,
disease
yeah, yeah.
is very, very crucial in the fight against cancer. And that is the reason we spend a lot of time in counseling, because cancer doesn't just affect the body, it affects the body, mind, and soul. So, just treating the body won't help. So, before initiating treatment after the diagnosis, it is the duty of the doctor to counsel the patient, to give them that much needed inner confidence, to explain to the patient and the relatives about the various treatment options in a simple, easy to understand format. So, if one does counseling properly, then 50% of the battle is won. In my opinion, counseling is the most important component of care before even instituting treatment, because you're completing 50% of the treatment by giving that patient that much needed inner confidence.
Sir, I'm so enamored by you because I know of very many doctors who are faith driven, higher power driven. They understand that the invisible energy of which we all are born governs most of our lives and destinies. And this, in this day and age, when you spoke about mind, body, soul, it is very important to know, friends, that your prayer, your optimism, your mental and spiritual strength can guide you through, because science minus spirituality is unconscious, and spirituality minus science is lame. So I think the combination of both you brought to fore today has endorsed my belief that what works the best is a complementary participation of both.
Absolutely.
Coming to now, how do we manage breast cancers of various kinds?
So when someone presents with a breast health issue, one has to understand that when someone notices a painless lump in the breast, or a recent retraction of the nipple, or eczema around the nipple, or a blood stained nipple discharge, or puckering of the skin overlying the breast, these are some of the signs that one looks for and symptoms. When these changes are there, a woman should go to the doctor. And when she goes to the doctor, the most important component to diagnose a breast cancer or exclude it is called triple assessment. That is, the first component is to take a history, listen to the patient, very important. Second component is mammography and ultrasound. And the third component is ultrasound guided core needle biopsy. With these three triple assessment, with these three methods, one is confidently able to say whether or not someone has a cancer. So when someone walks into a doctor's chamber with a lump in the breast and the doctor says, come in tomorrow, we'll do an operation, then you should run away from there, because
Yeah.
you don't need an operation straight away. You can get a diagnosis without the need for a knife on the skin. So once the diagnosis is made, then as we discussed, counseling is very crucial, and then staging is done to assess whether the cancer has spread or not, and then the treatment is decided by a multidisciplinary team that comprises of the surgeon, the radiologist, the pathologist, the medical oncologist, and the radiation oncologist, because one size doesn't fit all. The treatment is personalized. But there are essentially five components of treatment. One is surgery, the second is chemotherapy, the third is radiotherapy, the fourth is hormone therapy, and the fifth is targeted therapy. Which treatment is required for whom is decided by this multidisciplinary team.
Sir, if may I say that nutrition plays a very important role either in feeding cancer or stifling the cancer growth. Like what we do in our practice is that we completely eliminate foods that antagonize, instigate, and aggravate cancer cells. And on the other hand, we feed humans with absolutely clean food full of life force, life source, which is very alkaline in nature, which puts back the body in its regulatory, self regulatory mechanism, which in turn harmonizes the hormones and triggers better endocrine behavior. So, do you support this theory that if the cancer patients are fed well selectively, scientifically, they would show better results as opposed to people who eat ignorantly?
I think eating a healthy diet is very essential, not only for cancer, but for any
Anything,
lifestyle
yeah.
disease. And eating mindfully, fresh leafy vegetables, plenty of fruits, vegetable diet.
I love
And if
fruits.
one has to eat non vegetarian, eating only chicken or fish, which is lean meat, and avoiding red meat, avoiding smoking, and preferably drinking as well. And if one has to have a drink, to be very conscious of how much they are drinking, because all these things can be associated with increasing the risk of developing cancer. And alcohol and smoking are strong risk factors for even getting breast cancer. So, how does one get breast cancer? So, any factor that increases the prolonged action of estrogen on the breast can potentially cause breast cancer. And the common risk factors are being a woman, obviously, and previous history of breast cancer. In addition to this, early menarche, late menopause, and in this day and age, a lot of lifestyle factors like late marriages, not having children,
Hmm.
having the first child after 30, not breastfeeding, obesity, these are all lifestyle factors that can potentially cause breast cancer. So one has to be very mindful of what they do and what they eat and how they behave. And also, as we discussed, it is to keep the mind peaceful as long
I'm
as possible.
I'm so creatively overwhelmed. May I say Raghupati Raghav Raja Ram, Patita Pavan Sita Ram. I think you are the perfect embodiment of science and spirituality, such a balanced approach and a deep empathetical approach for a surgeon to say that don't rush to get under a knife. I mean, it's so ethical, and ethics are so important. So remember, friends, that for those who will push you on the in the operation theater pretty much soon in life, kindly take second, third, fourth opinions, because the next question is about counseling.
Yes.
So, opinion and counseling, two are great pillars to determine whether what is your next line of treatment and whether you're sure that you're on the right line of treatment.
Absolutely. So, before commencing treatment, counseling is paramount.
Paramount.
And when someone is told that they have cancer, it's like a veil in front of the doctor and the patient. Whatever the doctor is saying, the patient can't hear. And so the patient may ask the same question and again and again. So the doctor should not become impatient, should not be rude. That's the most vulnerable moment for that patient. And that's the time when the patient must be given a lot of counseling in terms of giving the support, the much needed inner support, and to the people around the patient. So, when my mother had breast cancer, I was in the UK, and when she was diagnosed with breast cancer, she was a practicing gynecologist. She was counseled in the UK by a breast care nurse. So when I decided to come back, she said, whatever you wish to do back home, never forget the importance of counseling. And I took her word seriously, and till date, it's been 19 years since I relocated to India, we give utmost importance to this aspect of care, which is often neglected in our country,
Yeah.
because counseling was not even part of our medical curriculum until 2018. And even though it is now part of the medical curriculum, it is not assessed formally in an exam situation. And so when you work abroad, you realize the importance, the weightage that is given. But when you come back, you tend to forget it. But when you stick to these principles, you will never go wrong.
You know, counseling is like in Ayurveda, there's a treatment called Vaman, induced vomits, to cleanse your within. Counseling helps you cleanse your fog of the mind. Counseling gives you clarity, and counseling gives you a very creative direction towards your treatment. Talking about treatments, I completely endorse all the medical treatments. But, sir, me being the other side of the spectrum, being in therapies, and we have MSc level yoga therapists, yoga, therapeutic yoga masters, where we do different kinds of yoga, especially to address the lymph drain, where we make sure that circulation is proper, where we make sure that oxygenation is enough, where we make sure your T cells and B cells are triggered enough, and where we make sure your diaphragm moves well enough, your insulin management, glycogen management, and renal functions are stimulated enough. Would you endorse, or would you have an opinion that a real good lifestyle, which does not claim to fix cancer, but at least support the speed of convalescence and increase the chances of better health?
Of course, I think yoga and meditation definitely helps in healing the body, mind, and soul. There's no doubt
Yes.
about it. So, yoga and meditation are uh, certainly adjuncts to the primary care that is delivered by doctors. And in fact, there are some people who who take alternative therapy, and when patients come and express their views about alternative therapy, it is common practice for allopathic doctors to rubbish them. I don't rubbish them, because by rubbishing their views,
Yeah.
you're going to not have compliance. So the way I do is in my counseling is to take them on my side, make sure they listen to what is required for them from the allopathic point of view. And if they wish to take something else in addition to this, as long as it doesn't contain any aggravating factors like
Yes.
estrogen, etc., I don't come in the way, because that is their lifeline. They think that that helps, but I know that it won't help. But if I tell them so, they will get discouraged and they will not take the allopathic treatment as well. So it's very important to take the patient's views,
Yeah.
not to rubbish them,
Not
at the
rubbish.
same time, making sure that they become compliant to what is advised.
Yeah. So I think modern medical science compliance is so important. And then whatever you need to do as a part of therapies which does not contradict or go diametrically opposite the medical science treatments. You know, in what we do, we also have sound healing. Now, sound healing, there is a science established today that psychoneurocellular synchronization happens. We reorient ourselves, and even a mitochondria behavioral change is noticed. We also make people sing, we make people listen. Now, these small things which uplift, upregulate, and upscale your immunity, make you feel better, I guess will certainly support convalescence and improvement of health. But I'm coming to one very sensitive topic. Vedic astrologers always said that never do surgeries close to the full moon, because that is the time the moon's magnetic field is attracting storms, high tides, your plasma, your tattva, your rasas. There is a chance of bleeding. Would you look into that while you are performing a surgery, if your patient says that I wish to abide by the same. Of course, any emergency surgeries, friends, please, they have to be done pronto. But you have an option of 2 weeks, 3 weeks, 4 weeks. What are your views?
So, breast cancer surgery is never an emergency. So to speak, when someone has breast cancer, if someone says surgery tomorrow, it means emergency is for the doctor, not for the patient. So I never ever rush the patient
Yeah.
because counseling takes time. It may take more than one session. So until the patient's mind is prepared, we don't take our patients for surgery. So if the patient wishes to delay by a week or 2 weeks, it's not going to be the end of the world because cancer doesn't spread like that. A panic is created amongst patients that if we leave 2 or 3 days and we operate next week, the cancer might spread. And so it's very important to understand that cancer doesn't spread so fast. Even in a country like UK, the average waiting time between the diagnosis of cancer and the surgery is about 4 to 6 weeks. So therefore, if someone has these superstitions or a view that they wish to be operated on a particular day, I totally comply with that. But I don't follow any such principles because my principles is to keep the patient safe, and when I am operating, I should reduce the blood loss to the minimum. So by taking adequate care, by meticulous attention to detail, we are able to get patients up and about within few hours after surgery, and many of our patients go home on the same day in the evening or on the following day in the morning, and they when they go back to their work. They can cook, they can walk about, they can do all their activities. They may have a drain bag if required, but we mobilize our patients pretty quickly after surgery. There's no question of rest in our dictionary.
Raghu, I'm so overwhelmed creatively once again. What comes to my mind, I want to sing praises of you in Sanskrit shlokas. That Raghu is a perfect embodiment, epicenter, and epitome of the lines I'm about to speak. Asatoma sad khamaya, tamsoma jyotir khamaya, mrityuma amritam khamaya. I think you touch anybody's life, Raghu, that person will never succumb. If they comply with you, they will fly with you. So, Raghu, on this note, what are your last parting lines you'd like to tell all our patients and people who could become patients?
Right. So, a woman is the nerve center for our family. If she is well, the family will be well, and family will thrive, in fact. If she is not well, the family will be affected in a big way. And it's the duty of the men. For example, if your mother, your spouse, your sister, your grandmother, anyone over the age of 40, it is our bounden duty to make sure that the women in our lives get an annual screening mammogram from the age of 40. And we have a lot of festivals. We give a lot of gifts, we give a lot of sweets, we new clothes. You can still do that. But in addition to that, or instead of that, if you can gift your loved ones over the age of 40 an annual screening mammogram, we would have saved scores of lives. And secondly, anyone noticing any new change in the breast, please do not ignore. Go to your doctor. And as I said earlier, if you're 40 and over, certainly have an annual screening mammogram and spread this word around.
Friends, I think today we saw a perfect reflection of science, body, mind, spirit kind of explanation. There couldn't be a more crystallized way of talking about breast surgeries and cancer other than our Dr. P. Raghu Ram deciphered for us. I believe that certain things from a Vedic understanding, like swasth, one definition of swasth is swayam mein asta, super self confidence and confidence in the higher self. Number two, your swas, because without breath we can't last for more than a minute. So, श्वास से बने स्वर से बने सुर से निकले गीत, श्वास स्वर सुर गीत संगत में हो तो श्वास बने संगीत. If you want your health to be music for health, healing, and wholeness. Breathe easy, rhythmic, and relaxed. So, on this note, let cancer be neutralized with Dr. P. Raghu Ram.
Thank you.
Every woman and breast cancer be Mickey Mouse.